Hello friends, welcome to part 2 of Bryonia. Now in this section I'm going to tell you how Bryonia generally and most commonly adapts in all kinds of illnesses, be it anything. So it's a well-known remedy for arthritis, it is a well-known remedy for joint problems. Okay, now why joints are affected, why his motion is getting affected? Because we all know that it is there in the rubric talking business of. When it comes to work, business is possible when you are moving around, when you have to go daily to the office, when you have to do the daily chores. Like for a housewife, it is important to move around the house and maintain the house in proper order. Okay, for a person who is a businessman, he has to go to the factory visit, he has to go to his site. So movement is essential for Bryonia. Now if you see the rubrics, it is there in the rubric restlessness, motion aggravates. Now motion aggravate and movement is essential, the motion is essential for him to do business. So we will try to understand what these contradictory state of rubrics hold meaning for. Okay, like there is carried desire to be carried, as well as carried aversion to be carried, as well as fear of being carried. So we will understand this process in a very systematic way, that when he lands in disease and when he wants to come out of his disease, how this entire thing, jumbling of rubrics takes place. Okay, so why of Bryonia we have understood in the earlier section. Now when he comes to a state where he feels that I am sick, there is something which is troubling me, and he knows exactly what is troubling him. If you try to reason out with Bryonia, it's very difficult, because Bryonia is in reason, power of reason increased. Reasoning power of reason increased. So you cannot reason out with Bryonia. If he says that I have got malaria and you try to prove him wrong, he will give you all the justification that why he feels that he has got malaria. If he says that I have got dengue, then he will specifically point out all the reasons for why he feels he has got dengue. You cannot reason out with him. You cannot give your points. You will find this in most of the cases of Bryonia. They are that intelligent, they are that powerful, and they have got those reasoning skills very, very strong. Like for what they feel, one lady was there, and her way of talking, she had so much of power in talking. She was a lady who was working for a very reputed company, and she had come to me for problems. She had come to me in various stages, like before her first child was born, after her first delivery, then she resumed her working, then after her second delivery also, and all these while she had only been in state of Bryonia. I used to think, the intensity with which she would present herself, the intensity with which she would talk and everything, I would feel, she would be something like Lachesis, a very passionate lady. Injury, being injured was very apt for her, because she would specifically point out that this is the cold thing that is affecting my throat, and I know when I have this cold drink I get it. My throat just goes off, I'm not able to speak, I'm not able to drink and all that. So delusion, injury, being injured, she knows precisely, and you try to reason out that it is not the cold, it could be something else, because this is taken by everybody, but I know it doesn't suit my body. And you just cannot reason out. For everything she would reason out. She would not shut her mouth in front of her in-laws also, of her husband also, and even in the office she was a very strong-headed lady. So this is one kind of presentation, whether she is sick or whether she's not sick, but her state of bryonia continued for almost 7-8 years till the time I knew her. Okay, then so what happens, they know exactly what is giving them sickness. Now when they fall ill, what happens, they want to be carried. Okay, why they want to be carried? So that, as you all know, to carry on with their business, to carry on with their day to day affairs, which are very important to them. Okay, it is, so business is like, it's the most important thing for the person to do, and they just cannot leave it. She will wake up early in the morning at 6 o'clock, and she will wind up all the work, she will cook, she will do this, that, everything, and she will leave home at 8 o'clock. She will drop her child to school and just leave. Whatever it is, no matter what, hook or crook, I have to go to office, means I have to go to office. If that routine breaks, if I get delayed, it really irritates me. It plays on my mind whole day, that how could I get late for work. And she has to go, if there is sickness, she's supposed to take a break. No, I cannot take a break. So when is the time that Bryonia takes a break? It is there in the rubric rest desire for. Home desire to go home, but when there to go out. So when the disease lands them into a state where they understand that now I need to be carried, now is the time that I need to take some medicine, now is the time I need to go to the doctor, they will just go. They will tell the doctor that get me soon out of this shit, and I want to resume my work because I just cannot stay away from it. The work they do, they see the kind of descriptions I have given you. Delusion is working hard. They feel that their work is very important and they're working hard for it. They have got deadlines, they have got so much to do. They're excelling in their work. Okay, delusion is working hard, they're putting their best effort, and delusion occupied about business. I'm not somebody that who can sit at home. I have got hundreds of things to do. They can talk in this way. You will feel as if it is egotism, but this is the reason, power, and the hard work that they are portraying in front of you. Delusion occupied about business. Standing aggravates, lying aggravates. They cannot stand at one place. I'm not a lady who will just stand and say that, it's okay, I will not take a break. That break is something that they don't like. To stand at one place is not fruitful, it is not productive. Lying is what? Again, you are not giving any result. You just lazing around. No, this is not something that I can accept. You will feel it is ego, but it is Bryonia. Okay, Bryonia is not there in egotism. They are people who believe in doing work. They are people who will just want to keep moving around. Okay, although motion is aggravating. Now, how this balancing of all rubrics takes place? We are going to do that. Okay, so when they are working hard and they understand that I am being injured, I am having some kind of illness, my body is suffering, I have got some joint pains, I have got this pain, that pain, throat pain. So that is the time they understand that I need to be carried. Moment they go to get carried, they will go in a state of rest desire for. They will give their 100% to recover. Okay, rest desire for, quiet wants to be, and uh, for what reason? For the sake of business, they will take rest. And that time, disturb averse to being, irritability when questioned, irritability when spoken to being, they will just not want to talk to anybody. But yes, if there is a phone call from office, they will want to attend that. They will check their number. If it is sister, brother, and friends or anything, they will just disconnect it. If it is their office, if it is their boss, if it is some employee, if it is something got to do with their work, they will attend that call. For doctors, it could be a patient. So yes, I am just off for a day. Tomorrow I'll be back. I'll fix up your appointment. So on work, for work, there is no compromise to Bryonia. They will take rest, and the thing on their mind will be that I have to get back to work soon. I have to get back. I have to rise up. I have to go back. Why this kind of thing is there? Because they don't want to be carried all the time. Fear of being carried, like if I am being carried like this only, then my work will get hampered, and they will come out of that state and switch over, and they will just go to work, and they will keep on going with their illness. But somewhere they will gain that energy with rest, that now they can carry on with their work. Now they are in a position where they have regained the lost energy, and somehow they will just bounce back, and they will go to their work. And after going to work, there is, I told you about standing and lying, and they are in wandering desire for, traveling desire for. This is something, they can't sit at home. They want to just go to work, as we discussed. Then traveling and wandering desire is something that they get with their work. So when they are working, they are also in their movement. Traveling and wandering is what giving them movement, so going from one place to other. And so I used to think Bryonia to be some other remedies, but then all this came up, and this was a retrospective understanding of Bryonia from all the cases that I have got, that they are in traveling and wandering, and they just love to explore places. They will go here and there, and it's along with business they are doing all this. They like their journey of their work. Okay, so when they are resting, rest is giving them a lot of fears and anxieties. So anxiety about what? When they are resting, when they are sick and they take rest, they have anxiety money matters about, anxiety compelled to do something, that if I keep resting, then what will happen? Who will take care of the work? Who will take care of the money? Who will bring that inflow into the house? So they want to come out of this state. Okay, compelled to do something, anxiety business about, anxiety driving out of bed. So this is the anxiety. There is a compelling force which puts them out of their bed and out of that rest. Okay, closing eyes aggravate, that they just cannot close eyes and keep taking rest, because the moment they close their eyes, the work keeps going on, and the needs of the family, the needs of the household affairs, that this is to be brought, that is to be brought, the money has to fall in, that money has to fall in, and the needs are to be taken care of, and I am supposed to do it. Who else is going to do it? So all the fears are there, a lot of fears are there. And the biggest fear, it's given the rubric, delusion rising could not rise up again if he stooped. So if I stoop now, if I rest now, if I bow down to my illness now, then if I do it for a longer time, I won't be able to rise again. What if I take a prolonged rest? Then my body, my joints will get stiff, my body will get stiff, and I won't be able to rise up again. If I just continue to take rest for a long time, and if I come out of that habit of, if I'm not able to come out of the habit of taking rest, then again I won't come back with that same energy. It will take a long time for me to get back to work. So this is something that pushes him out of bed, and he comes to this state where he wants to keep working hard. He wants to, delirium, anxious business. He wants to keep doing his business, and that anxiety about business he carries all the time. So in that lady I told you, she had recurrent urine infection after second pregnancy. She was not able to understand what's going on. She avoided coming to me for till the time her child was very very cranky and in a state where she had to be forced to take to resign her job. And that is the time when she thought, it's getting too much and I need to see Pallavi now. So because they had moved their house and they were in a different place altogether. From there she came to me, and it was a long distance, but since she had a experience prior with me, so she came back and told me that, this urine infection recurrent, I don't get it why it is happening. I'm drinking a lot of water, I'm doing this, I'm doing that, and everything that the doctor has told, I exactly know that it is not because of lack of water, because I am taking lot of water. I'm taking at this time, that time, that time. So the precision and the force is very peculiar to Bryonia. So I would keep continuing with Bryonia in the next video. Two very important rubrics coming up. So do comment, like, comment, and subscribe. Thank you so much.